Dr. Aggarwal's Ayurvedic Panchkarma and Research Center is a traditional Ayurvedic center practicing Ayurveda in its most natural form. Dr. Shridhar Aggarwal is a renowned Ayurvedic doctor. In the career span of more than 11 years, he has done researches on various herbs and developed such medicines and treatment techniques that helps to cure kidney failure. Chronic kidney disease is a major issue nowadays with people of different age groups suffering from it. It is basically retard in the functionality of the kidney. Kidney is not able to perform the basic function of filtering the blood and removing waste. For that, in allopathic treatment, the process that is followed is dialysis. It is the artificial removal of waste and excess water from the blood and is used as an artificial support till the donor is available for transplant or the patient's condition is physically stable to go for transplant. Having seen such complications associated with allopathic treatment for kidney failure, we definitely have to look for some alternative option available. Ayurveda is another form of medicine that has been well practiced since years ago. According to Ayurveda, kidneys are made up of Rakta and Meda dhatus. To treat kidneys, we have to treat these two dhatus. Human body is made up of three doshas, Vata, Pitta and Kapha. When they are working in synchronized manner, it depicts a healthy body system. If even one of these is vitiated, then it signifies a diseased state. In renal impairment, Kleda Kapha, Apan Vayu and Pachak Pitta are vitiated. Ayurveda works to synchronize these three doshas to treat kidneys. Goals of Ayurvedic treatment for kidney failure. Ayurvedic treatment goes to the root cause of the disease and treats it, supporting the kidneys till they have healed and can work properly, preventing and treating the complications that are associated with chronic kidney failure. Multiple actions of Ayurvedic treatment for kidney failure. Renormalization of urinary pH, diuretic, antimicrobial, antioxidant, decreasing proteins in urine, playing the roles of kidney, repairing renal parenchyma, and renormalization of urinary pH. There are many well-researched herbs that helps to renormalize and maintain the urinary pH in the alkaline range, that is from 7.5 to 8.0. Diuretic action. There are herbs which have diuretic action, that is, they help to increase the urine flow, which is the basic symptom observed in kidney failure patients. Herbs like Bordhavia diffusa, Acaranthus aspera, Tribulus terrestris all have diuretic action. Antimicrobial activity. Ocimum basilicum, Tribulus terrestris, Equisetum arvens. There are many herbs which have antimicrobial action which fight against the pathogens that are responsible for urinary tract infections. Other herbs like Rubia cardifolia, Ocimum basilicum, Equisetum arvens, Cyprus scariosus, they have anti-inflammatory activities. Antioxidant activity. Herbs like Rubia cardifolia, Ocimum basilicum, Equisetum arvens, Pectona grandis have strong antioxidant agents. Decreasing proteins in urine. Apart from increase in urea and creatinine in blood, some patients also have presence of proteins in urine. There are well-researched herbs that helps to control the proteins in urine like Withenia somnifera, Tribulus terrestris, Quercus infectoria, Swartia cerata. Playing the roles of kidney. As we stated, the goals of Ayurvedic treatment for kidney failure, these herbs also support the kidney functionality till they have healed, like Tribulus terrestris, Bordhavia diffusa, Croteva nervala increases urine flow. Some herbs excrete urea and creatinine through fecal route, like Rubia cardifolia, which helps in excretion. Repairing renal parenchyma. When patient is suffering from chronic kidney disease, there is degeneration in the physical structure of kidney. According to the reports, the kidney size decreases. Ayurvedic treatment works to repair the renal parenchyma, and many cases have been observed where kidney size has increased after the Ayurvedic treatment. Burhavia diffusa, Tribulus terrestris, Pistacia lentiscus repair and rejuvenate the renal parenchyma. Phyllanthus neruri, Sicorium intybus have antibacterial and antiviral action. They clear the viral overload from kidney and liver. Withania somnifera decreases the pressure on kidneys that is created by diuretics, decreasing urea and creatinine. Tribulus terrestris, Burhavia diffusa, Creteva nervala increases the urine flow. Moringa oleifera has Aksheva property, that is, it relieves intoxication and increases urine flow. Asparagus racemose, Berberis aristata and Trichoxanthe dioica helps in decreasing urea and creatinine. Decreasing cardiovascular risks. In many kidney patients, there have been seen rise in cardiovascular disease. Cardiovascular diseases are also caused because of processes involved in allopathic treatment like dialysis. Herbs that help to decrease cardiovascular risks are Rubia cardifolia, Withania somnifera that reduces stress also. Heavy metal issue. Many people have concern that Ayurvedic medicines have heavy metal content. Yes, we do have heavy metals in some of our Ras Rasayan medicines, but the medicine that is prescribed for kidney patients is 100% free from it. Whatever medicine we prescribe is our own preparation. The herbs are organically grown, hand-picked and processed to give you the desired results, and they are free from any heavy metal content, free from preservatives even. Reducing the frequency of dialysis. As we have said, dialysis is just an artificial support for kidney. It is not the actual treatment. Myth. Dialysis once started goes on increasing in frequency and the final option is transplant. Yes, this is true with allopathic medicine, but not according to Ayurveda. Can we stop dialysis? Not possible with allopathic treatment, but with Ayurvedic medicine, this is also possible. Even dialysis can be stopped in a specific period of time, which obviously depends on patient's response to the treatment. Transplant. Transplant may seem as an easy option over going for dialysis for a long time, but this is not true. After transplant, some immunosuppressant drugs are given to the patient so that patient's body does not reject the transplanted kidney. But because of these immunosuppressant drugs, body becomes susceptible to other infections. Transplant thus increases the lifespan from 10 to 15 years in 80% of cases. The rest patients are diagnosed with kidney failure again within 2 months to 5 years. A simple comparison between transplant and Ayurvedic medicine. In case of transplant, lifespan increased from 10 to 15 years in 80% of cases. With Ayurvedic medicine, lifespan increases from 20 to 30 years or even more. In transplant, the surgery cost is approximately 5 to 7 lakhs INR, and the immunosuppressant drugs that are given after that costs up to 12,000 to 20,000 INR per month. The Ayurvedic treatment for kidney failure is quite nominal in cost. Transplant is a major surgery and 20% patients lose their life due to complications associated like septicemia, There is no such case with Ayurveda, as these herbal medicines are quite safe. After transplant, patient is able to do only household chores and some basic work. But with Ayurvedic medicine, patient is able to enjoy life and work normally. Acute rejection occurs in 10 to 25% of people after transplant during the first 60 days. 99% of the cases are able to take up our medicine. It's just the trust factor that works with Ayurveda. Post-operative complications, bleeding, infection, vascular thrombosis, and urinary complications are involved with transplant. With Ayurvedic medicine, there are no such complications. A 75-year-old patient, if goes for transplant, he gains an average life of 4 to 5 years. But with Ayurvedic medicine, even older patients respond very well and they are able to live a long, healthy life.